Welcome to The Explainer. Okay, today we're diving into something that sounds like it's straight out of a horror movie, but is a very real and very serious medical emergency: gas gangrene.
So here's the big question we're tackling today. How can something as common as a simple cut turn into a terrifying, fast-moving infection that becomes a life or death situation? All right, so how on earth does this happen? To really get a grip on the threat, we first have to know exactly what we're dealing with. So what is gas gangrene?
The words you really need to focus on here are fast-spreading and, of course, fatal. This is not an infection you can just ignore and hope for the best. Its fancy medical name, Clostridial myonecrosis, really tells the whole story. It's the death or necrosis of muscle tissue, and it's caused by a very specific kind of bacteria.
And honestly, it's the speed that is just so terrifying about this whole thing. This isn't something that slowly develops over weeks. Nope. It can become life-threatening in a matter of hours, sometimes before a person even realizes the true danger they're in. Okay, so let's get to know the bad guy in this story. Who is this invader, and how does it manage to cause so much destruction so incredibly fast?
All right, meet Clostridium perfringens. This is the microbe that's responsible for all this chaos, and it has a really unique and deadly trait that makes it so incredibly effective.
So here's the thing that makes Clostridium such a real outlier. You know, most bacteria we think about are aerobic. They need oxygen to live, just like we do. But this one, it's an anaerobe. It doesn't just survive without oxygen, it thrives in it. And that, right there, is its secret weapon. So this thing is picky. It's not just going to set up shop anywhere. It's actively looking for these very specific low-oxygen spots to flourish. So think about a deep puncture wound, maybe some crushed tissue from an accident, or any injury where the blood supply is cut off. That's the perfect 5-star resort for Clostridium perfringens.
And this is where it gets really nasty. It's a vicious cycle, right? The bacteria gets into a wound and starts pumping out toxins. These toxins create gas, which gets trapped and starts blocking off tiny blood vessels. This kills the tissue, which in turn creates an even bigger, more perfect oxygen-free playground for the bacteria to expand into. It's like a fire that literally creates its own fuel as it burns.
Okay, so you've got this nightmare scenario unfolding inside the body. What does that actually look like on the outside? What are the warning signs, the alarms that start going off when the body is under this kind of attack?
Yeah, this timeline is just chilling. It starts out with intense pain, like way more pain than the injury seems to warrant. Then the skin's appearance just rapidly changes, and those blisters you see, they're actually filled with the gas that the bacteria is producing. If it gets to the late stages, the body systems just start shutting down.
And it's not just what you can see. There are other big red flags. The wound itself might start to smell, well, rotten. You'll see a high fever, a racing heart. That's the body screaming that it's in crisis. The toxins can even start destroying red blood cells, which causes the skin and eyes to turn yellow. That's a condition called jaundice.
So when you're up against something this aggressive, the response has to be just as fast, just as intense. It is a genuine race against the clock.
And let's be crystal clear about the stakes here. Without treatment, the fatality rate for gas gangrene is 100%. 100. It is always fatal without intervention.
That's why there is zero time to wait around and see what happens. The second a doctor even thinks it might be gas gangrene, it is all hands on deck. An emergency protocol kicks in because every single moment counts.
So the counterattack is basically a three-pronged approach. First, you hit it with massive doses of IV antibiotics to kill the bacteria. Second, you have to go in surgically and remove all of that dead and infected tissue. And in the most severe cases, amputation might be the only choice to actually save the patient's life.
There's another really powerful tool in the arsenal too: hyperbaric oxygen therapy. Basically, they put the patient in a high-pressure oxygen chamber, which floods the body's tissues with oxygen. You're essentially turning the bacteria's safe haven into a toxic death trap. It's a direct counterattack on its home turf, but it's a very specialized treatment, and it isn't available everywhere. So after hearing all of that, I think we're all asking the same question. How do we stay far, far away from this horrifying situation in the first place?
And this is really, really important. There is no vaccine for this. You can't just get a shot and be protected. That means our only line of defense is being incredibly diligent and proactive with wound care.
So what's the bottom line here? Clean every single wound, no matter how small, and clean it well. You want to deny this oxygen-hating bacteria any chance to move in. And then you have to watch it. If you see any signs of infection, swelling, redness, pain, don't wait. Get it checked out. Because when you're talking about an infection this dangerous, proper wound care isn't just about hygiene, it's about survival.
I mean, after all this, are you ever going to look at a simple cut and scrape the same way again? It's a pretty stark reminder that even the smallest injuries deserve our full attention, and it really shows you just how fragile that balance of life is, happening right under our skin.